Hello, this is Federico Barnabè. Today I'm going to present a work in progress titled Increasing Value in Healthcare by Leveraging Integrated Care Pathways. As you can see from the title, we focus on a specific traumatic event leading to femoral fractures. I'm going to present this study also on behalf of my co-authors Riccardo Santoni, Maria Cleo Giorgino, all of us from the University of Siena. So coming to the problem statement, we're analyzing a situation in which the global population is continuously increasing. It's not just a matter of numbers, it is also a matter of the fact that the population is continuously aging. This demographic trend is going to generate quite a lot of impacts, definitely on fiscal systems, labor markets, and also on healthcare. Specifically, healthcare systems will be called upon to provide increased care, not just in quantitative terms, but also in order to address the needs of elderly people, especially those with severe or chronic diseases. And this is going to happen both within hospitals and at the territorial level. So the model of integrated healthcare is suggested as a potential solution to address all of the challenges above. This model specifically emphasizes collaboration among healthcare professionals, care organizations at different levels, and the patients who are assigned an active role within the system. So far, we have started analyzing the integrated healthcare pathway with specific reference to femoral fracture care pathways, and we developed a qualitative SD map to represent such pathway, and we are quantifying the map in order to develop the SD model to be tested and used subsequently for policy analysis and policy recommendation. Three main areas have been identified so far. Pre-hospital, where patients are not yet patients, so they are still at home and the traumatic event might occur. The hospital phase, and then the post-hospital phase and care provision. A case study is under development in order to investigate how to structure integrated pathways and design policies in practice. This map, in a rather aggregated way, represent the model that we are developing. We have the three phases that I mentioned before being hospitalized. So when the injury occurs, then the patients access the hospital and undergo surgery. They get rehab within the hospital, and then they are discharged going back home, or they are assigned to other care organizations at the territorial level. There are question marks here that are driving our analysis, so we need to identify and investigate the causes at the basis of the traumatic event. We need to understand how the operations are carried out within the hospital, so in order to increase their effectiveness, and we need to understand what happens after being discharged and going back home. The stars with the letters A, B, C, D, and so forth represent areas or points in the system where strong interaction among professionals, patients, and other actors occur. So they are leverage points where we can intervene in order to enhance collaboration and improve the effectiveness of the system. As we mentioned, the integrated pathway also entails quite a lot of other actors at the territorial level. So the interplays among all of these actors are mapped and explored, and the ultimate goal is to identify leverage points on co-production areas in order to increase the effectiveness of the system and optimistically or hopefully reduce reworks in terms of patients that need to be re-hospitalized again, to access the hospital again, to undergo surgery again, or to receive treatment in a specific way. Of course, also death rates are at the center of the analysis. So in the end, the research should demonstrate how integrated healthcare can function in practice using the co-production framework, but also relying on SD principles and tools to assist our analysis. And the main policies that have been identified so far and will be tested using the model include strengthening prevention. Quite a lot of prevention actions might be implemented, enhance collaboration among professionals and care providers at different levels, so not just within the hospital, but also empowering patients who will be increasingly assigned an active role within the system, and overall improving care pathways and resource allocation at different levels. So thank you for your attention.